member for Dartmouth North.
Madam Speaker, this government is dialing back the care they give pregnant Nova Scotians. It used to be standard to get 2 routine ultrasounds during a pregnancy, but staffing shortages are so bad, they've changed their own guidelines to having just 1 halfway through pregnancy. Thanks. Madam Speaker, my question is, how else is this government planning to lower the bar for women's health in this province?
I recognize the Honourable Minister of Health and Wellness.
Thank you, Madam Speaker. So certainly over the last number of years, we have invested heavily not only in the people that we need to run the machines that we need to do testing, but also in the testing themselves. So we do have a new clinic, particularly in Central Zone, and that clinic is run by students. It's on Fenwick Street. It's an incredible opportunity for students to work with the equipment that they will be working when they're hired. It's expanded capacity in Central Zone, in particular around ultrasound technology, and also training our next generation of healthcare workers. We work every day with clinicians. The folks at IWK are the experts. My understanding is that this change in policy still puts them well within Canadian guidelines for ultrasound in uncomplicated pregnancies.
I recognize the Honourable Member for Dartmouth North.
Madam Speaker, the minister said pregnant women could travel to another health zone to get another ultrasound if they wished. We've also heard that labour and delivery is so busy that people are being sent to other health zones to have their babies. Speaker, people want to have their babies close to home with the care and the scans that they need. Can the minister tell Nova Scotians when this government will be able to meet the demand for prenatal and birth care?
I recognize the Honourable Minister of Health and Wellness.
Thank you. I've never met a birth that anybody could stop, Madam Speaker, so I think we regularly in this province meet the demand. Of course there's travel. Of course there's places that we have to travel to have care that we require. Folks from New Glasgow travel to Antigonish to have their babies. That has been a typical a travel pattern within communities. We should never put a circle around where people can get care. People from rural Nova Scotia have been traveling to Central Zone since the beginning of time to access care in this province. This is a provincial asset. When we have an asset, we want all Nova Scotians to benefit. That's why we're investing in the Halifax Infirmary. That's why we're investing in EHS. We should never put a circle around and say this is only for Central Zone. We are investing in health care for all Nova Scotians.